isn't personally directed to you. And as you develop rapport, you may be able to influence them. And this is a fourth stage, which is difficult because some people like to avoid them. That's another thing. So these are some of the quizzes that I put. Which of the following is true? You can pick one. Let's check. Shall we play a quiz? Are you all ready? Are you all ready? Shall we play the quiz? What do you think, Dr. Swati, Dr. Narendra, Dr. Sri Lakshmi?
Yes, yes, of course.
Okay, let's play the quiz. Yes is the green signal from Dr. Narendra. So I'm going to, which of the following is true of creating effective guidelines for achieving an ethical workplace? What do you think? Pick up one, A, B, or C. Quickly. Are we all on the same page? Is my slide visible to everybody? Yes, please look into it, read it. I'll just, hello. Yes, please. Jerin, shall we talk later? I'm in a class, in an interactive class. Yeah, yeah. Maybe in the night, I'll tell you. Okay, yeah.
It's D supposed to be. Maybe I'm like
Okay,
D.
let's see. All right. What about others? Sri Lakshmi, Dr. Swati.
And
I mean, there's no right or wrong, but you can always feel, free to, raise it. Okay, use a standard chain of command to report potential ethical violation. Okay, that's good. Wow.
I mean, like
Ethics.
I'm not sure about others' opinion. What confused, but still, I feel it is
Yeah.
D.
No, I endorse it. I'm not really, I'm just trying to get everybody involved into it, and so that they keep some uh, attention towards what we are doing it.
Yeah.
Half of our motivation is lost when we are online, and on the top of it, a subject like medical ethics or ethics in this is a very very dry subject, they feel, and many of us would also feel, I know everything, I'm not unethical, hence it doesn't matter should I learn it or not. That's the key difference, no? That's why it is going to be okay. So let's move on and try to look into it. Yeah, so that's the chain of command that is going to be there. So what are the tools to support ethical practices? You can get it through the policy. Crisp and clear. Does your organization have an ethical policy? That means ethical policy is nothing but what are the accepted values, standards, commitment, right? When you say that you are reporting late, you will be not allowed, or yeah, all those things, all those standard behaviors. That's the key policy. The policy is going to guide. If you don't have it, create it. It's always good. Like supportive activities, tie the code of conduct with the organization's core values. Give a copy to all the staff. Make the code available to customers also, so that they can report it. So in many cases that if you go and they don't give you the bill, it is written that if you do not get the bill, then the bill amount is free. So the customers insist on getting a bill, and the employees at the billing center, they will be more interested. They call and give them the bill, so that there is no corruption. Every money, every amount that you demit or remit to the organization is accountable for it. And unsupportive activities like failure to follow up the violated, you report it and nothing happens. Like it happens with Dr. Preeti's case. She must have reported it, but nobody paid a heed to it. Nobody paid attention to that. That's an unsupportive activity. Senior staff behave contrary to the code. They say do not indulge into unethical practices, but you look at your own seniors, they are violating it. Smoking is not allowed in the hospital, but your own doctors go and smoke. And you have seen it. How do you feel it? Isn't it? That's not really the great thing. So it's important to have the ethical or ethics policy in place. Be it professional dress, behavior, business expenses, entertainment, all of that, confidentiality, harassment, and discrimination. It's a clear case of dragging in KIMS. It amounts to any junior is being dragged against her wishes is amounting to ragging, right? Drugs and alcohol use, whistleblowing, all these part of the things. And the traits to promote for the ethical workplace: honesty, integrity, trustworthiness, responsibility, accountability, respect, courtesy, smiling, saying hello, hi, isn't it? Not showing too much of tolerating others, accepting them, justice, fairness, compassion, care, kindness, citizenship behavior in the community, right? Going that extra mile. If the lights are open, switching them off, right? That's about taking care of your. Just because security will close, it doesn't mean that. Okay. So the code of ethics example is this one. This is an example that is typical for major corporates, especially with the US. So you have lots of them. I'm going to present you one more case study. So in that case study, you will be able to see them. And what are the ethical business practices and sensitive transactions, especially the commercial bribery, accounting controls, procedures, many of them. So I wanted to know from you, we are only hardly 4 or 5 people here. So how do you react? There are a couple of doctors also in this room. We have 5. So how do you react to the reports that said that during the COVID times, the patients were billed extraordinarily, or the bills were escalated, or the bills were swelled? They charge more from the patient. Is that true? How do you defend as a doctor, or how do you defend that as a medical ethics profession? Yeah. Am I clear in my articulation and question? Hello? Are you all there? Yes, ladies and gentlemen, tell me. And also to use these are the conflicts of interest, fraud, similar irregularities, some bunch of them. And what about the suppliers ethics? So we are looking very deeply into each one of the the supply chain partners as well. How the whole organization, corporation is going to abide by the ethical principles. So, like refrain from accepting money, gifts other than nominal value. If they accept more than that, it is not agreeable. Refrain from that quid pro quo. So let's look at the other knowledge as well. So which of the following is the most useful activity to support the full adoption and integration of a code of ethics in your organization? Which one fits you? Pick one, A, B, C, D. Yes, please. Yes, go ahead and tell me. Which one?
D, sir.
D. Why do you think D?
D.
Yeah, why? Why, Dr. Swati?
The code should be available to everyone so that only unethical things will be
So
decreased.
treat the code as confidential or strictly internal document, okay? And make the code available to
Okay.
customers and business partners, okay? Fair enough. Yep. Let's look at and move on to know about it. Okay, this is a case study. Look at the organization, a large metropolitan radio station, and there is a, there are people, Nick, Justin, Shannon. There are co-workers, Amy, Nick's mentor, Judith, the vice president at the station. What is the situation? Nick just joined the company and completed his new employee training. And he noticed a document labeled Code of Conduct posted on the bulletin board in the break room and remembered a brief mention of professional behavior and expectations during his orientation program. So he asked his mentor, Amy, about it, and she said, I have never read it. I just do what my conscience tells me. Do the same, you will be fine. Okay. Now, few days later, Nick was meeting with his team, including his co-workers, Justin and Shannon. So this is a conversation. Justin, are you ready for the process improvement review? I hear the consultant will be here tomorrow. So Shannon said, who said that? Justin, his name is Jim Clark. Apparently, Judith highly recommended. I hope he doesn't mess up things, Shannon said. And I feel like things are running just fine. Justin, I know we can always get better, but sometimes it's just a cover for getting rid of dead wood. Eliminating position to get rid of certain employees or more easily than going through an official performance improvement and dismissal process. So few days later, Nick was making copies of and found a piece of paper left in the copy machine, and it was the bill from therapy session. The psychiatrist's name, Jim Clark, and the patient name, Judith Overton. Nick isn't sure what to do with this information. He goes to Amy for advice. Nick, am I acting unprofessionally to bring this up when it is clearly private? She left it in the copy machine, so it's not like I intentionally invaded her privacy. And for using her personal therapist for work may result in people losing their job. Amy, leave it alone. That's what I say. What's good could come of saying something. Who would you tell? Nick, well, according to our code of ethics, we have an independent committee to look into things like this. Isn't that where I would go? Okay. More interesting, Amy said, I would hardly call it independent. Oh, we have left then less than 10 minutes. Let's wrap it up. So this is what they say. Nick said, risk it. You mean retaliation for reporting? Now you are catching on. So Nick goes back to the office to think about what Amy said. He remembers that Amy told him simply to follow his conscience and would be fine. And that didn't seem fair, but Nick decided he didn't have enough information to make an official report. And that is how it is. Okay, so this case study tries to tell you about the private confidential information. So what myths or what activities did the organization do, or what ethical issues were present in the scenario? Can you comment on it, especially the third question? What are the ethical issues? Was he allowed to check into someone's personal records? What do you think? Your reaction, please. Your quick reactions to that, as we are almost coming to the end of it. Quickly. Yes, please do react. So that's a very wonderful scenario where you get a hand over the private information. And sometimes the private information can lead people to, resign as well. Couldn't hear properly. Okay, so sorry about it. Not a problem. Nevertheless, I think we have almost come to the fag end of it. I'm just going to use this one. So the code of ethics will always going to evolve as profession, and code of ethics is also a piece for an overall effort, and work will remain in the field as far as possible, and there are lots of ways to take care of it. Okay, that is what it is, and I have also given you or told you about the healthcare in India particularly and so on. So this is what I have for you, although in a jiffy that way I presented it, but overall I think that's the end of it from my end.